recording.
So Mary, how do you think that went?
I'm not sure. I mean, I think I did everything I was supposed to do. I listened, I did the heart exam, and I didn't really hear much of anything as we discussed. So it didn't help me so much in figuring out what the differential should be or the diagnosis should be. But what do you think?
So I have another question for you. After I gathered that history, what were some of the things you thought could have been going on with this patient?
Well, I was definitely thinking that this could be an acute coronary syndrome. I think that was the number one thing.
Okay. And thinking about that, if you're thinking acute coronary syndrome, what specific things do you think you would have looked at, or you would have wanted to look at if you were examining the heart?
I see. Okay. So I examined for the rhythm, which was normal, and I examined for murmurs. So looking for any valve defects, and I didn't actually hear one.
So if someone has an acute coronary syndrome, what kind of things do you think might go wrong in the cardiovascular system?
Well, we're really talking about lack of perfusion.
Yeah, and how might those physical findings express themselves?
Oh, I see. So things like listening for, you mean in the heart exam? Well, the patient had pain, which is why they came in.
So also if I'm thinking, going back to your cardiac physiology, you're probably closer to it than I am. But if someone does have acute coronary syndrome, let's think of the cardiovascular exam as more than just the heart. You said perfusing. What about, are the peripheral arteries, is the pulse strong? Is the blood pressure high enough?
Things like throughs. I should have examined,
Or actually just the strength, right? Okay. And, if the heart wasn't pumping as well, what were some of the other things that you think you might have heard?
Well, you mean like if the patient was in heart failure?
Right.
Okay. All right. So in that case, examining the neck veins would have been important, and that's something I didn't do.
And and maybe even the lung exam.
Sure. No, absolutely. Yes. Definitely should have done that.
So how would you say, if you could approach this exam, what are some of the things that you would have done differently?
Well, I definitely would have included a few more steps. So now that we're talking about it, I would have examined the pulse, not just for rhythm, but would have examined for amplitude. In addition to examining the heart for murmurs, and it would have been helpful to examine for the PMI, which is something that I don't do as often as I probably should based on this conversation. And then examining the neck veins for distension, and perhaps even for a bruit. And I did actually examine the legs for edema, so I did do that.
Okay. So listening to you say all that, how would you kind of describe what that exam is as opposed to what you were able to achieve in this encounter?
So it's definitely much more of a cardiopulmonary respiratory, cardiopulmonary vascular exam. And I really, because I walked in thinking, examining the heart, I was doing things much more, much more by habit, right? So I listened to the heart, I examined for the pulses, and I kind of am doing that from patient to patient. And I really need to carry through my thinking about what I'm looking for, maybe, and maybe keep that in mind a little more. That's something I should work on.
So what I hear from you is, and the words I would probably use is make it your physical directed toward your critical thinking on what's going on with the patient.
Yes.
So that can be sort of the focus to make that physical exam more hypothesis driven. Is that okay?
Yes.
Would you agree with that?
I would.
So let's think about a goal for the next time you're here with us.
So I actually, it makes sense how you described that earlier. To really, my goal would be to approach the physical exam in a way that really reflects my critical thinking and my clinical reasoning.
Mm-hmm.
So I do that with the history. I don't always think about that again as I approach the physical exam.
So your goal would be?
My goal would be to perform my physical exam with attention to my differential diagnosis.
Okay, sounds like a good goal. Let's write it down. How do you think you'll achieve it?
Well, I do actually think, before I walk into the room, I do actually think about my differential during the history. But I don't always think about that when I prepare for my physical exam. And I think in order to accomplish that goal, I would really need to think back on what the history I've gathered so far and revise my differential. And then think about what physical exam I need to be able to support that.
Okay. And so what are some strategies that might be helpful to do that?
I may just need to take a minute to just think before I start my physical exam.
Right. And maybe jot a couple of things down.
Yeah.
You know, one of the advantages, even though it's really fast-paced here in the hospital, you can do your history.
So.
Yeah, you can do your history, step out for a moment, jot your thoughts down, maybe even look up a few things so that when you go and do that physical exam, you are more directed. And maybe use some additional resources. Any resources you currently use to help you with your physical exam?
Well, when I'm in the hospital, I tend to, stick to something more like Dynamed, or if I really need to look up something, I'll go like to Up-to-Date, But that actually means I need to take more than a few minutes if I do that.
So there's a couple of really nice web-based things where you can look online where particularly if you're just taking like the cardiopulmonary, and you could look at that video really quickly. I always like Mickey's physical diagnosis book, and that's online too, and you can take a quick moment.
We have Bates videos that I can go back and review.
Yeah, so maybe if you do that before you're coming in, then you have sort of a repertoire when you're doing it next time. Okay. How do you know that you're doing it that way?
Well, I think for this, I can think about it and have a plan. I won't always know my plan is correct, though, until I, check in with you or the resident team.
Right, and that's fine, because that's how medical education happens. You'll check in, and if you find more and more that they're not asking you questions that you haven't looked for, I think that's a good sign that you're getting this down.
That makes sense.
Right. Okay, so maybe next time when you come back with us, we'll work on this.
Sure, that would be great.
If it's not me here, do you feel comfortable calling up, the next doc who's on?
Everybody's been really helpful so far. So I appreciate you giving me this opportunity to talk about it, for sure.
Do you find it's challenging coming and asking the attending to do this?
Yes. I feel like I don't want to get in your way. You're so busy, you're running around all the time, that asking you to do something else just doesn't seem
it's easy.
like
It's easy to feel that way. When you ask beforehand, that gives us a little time to strategize, and then when I'm watching, I know exactly that I'm watching something that matters to you, and I'm giving you feedback on something that you're working on. So we actually appreciate if you ask us early and we can weave it into what we're doing.
Oh, that's good to know, actually. Thank you.
All right, thank you.